Section 6. Treatment in the ED. This section is split into 8 parts, A through H, and is the longest section of End Paper Q Part A. It is important to emphasise that the sections are focused on your contribution to treatment of patients in the ED. Please do not record information about the patient's discharge or admission to hospital. Questions pertaining to these subjects are asked in Section 8. Whilst I'm not going to go through each subsection in turn, I would like to point out a few features that are important for you to note. First of all, many of the subsections are similar in that you can select medicines using drop-down lists. For example, here in 6A, where you're asked about whether you prescribed any medicines for the patient in the ED, if you choose yes, you're then asked how many medicines you prescribed. For 1, you'll be asked to report 1. For 2, you'll be asked to report 2. Similarly, for 3, you'll be asked to report 3. But for 4, you'll only be asked to report 3. As you can see here, you can choose the first letter of the drug name from a drop-down list. The entire BNF has been incorporated into the questionnaire. For example, if you choose C, you can then pick the specific drug. For example, calcium acetate. All drugs are included. Some are less likely to be prescribed in the ED, but nonetheless we've included everything just in case. You'll then be asked the administration route. This is to tell us more about the types of formulation you prescribe. I just want to point out something on 6H, procedures. First, did you perform any procedures to treat the patient? If you choose yes, you'll be asked to record up to 3 procedures below. If you just record 1, just leave the other 2 blank, procedures 2 and 3. Also, if you perform more than 3 procedures to treat the patient, please prioritise recording those which you've not previously recorded in forms for other patients. Given that there are many different procedures, Cheat Sheet 3 may be useful. We have provided the sheet to not only help you become familiar with where procedures are listed, but also point out certain procedures which you may instead have wanted to record under prescribed drugs in Section 6A. One good example of this is Entonox, which is listed under analgesia procedures, as you can see here. Similarly, oxygen is also listed in this section under airway or breathing procedures. Once again, we ask whether you carried out these procedures independently or with some kind of support from another healthcare professional. For example, whether you were observed or you actually did undertake the procedure with the support of another healthcare professional. You can select more than one of these. For example, if procedure 1 you did yourself, you would select independently, and if procedure 2 you were observed by another healthcare professional, please select the appropriate option.